I think that's got to go higher.
I'm going to try those. What do you think, better or worse?
All right, okay, well, see how it goes.
When I've seen healthcare providers in the past, I've always felt really uncomfortable going in because I wouldn't really have the same GP. I'd just go into a clinic and see whoever I could at the time that was bulk billing. And when I'd go in and they'd just ask the general questions like your age, and then it would get to your sexual health and things like that, and they'd be like, do you have a boyfriend? Just straight up, they would be like, do you have a boyfriend? They wouldn't ask partner or anything else like that. That would make me feel really uncomfortable, and like they were generalising me and making assumptions of me, and like a lot of the times I wouldn't want to answer that question. For a long time I wouldn't go to the doctors because of things like that, because I didn't feel welcome or accepted.
One of my more negative experiences with a healthcare provider was the psychiatrist. Because one of the questions he asked me was about whether I had any sexual fantasies. He didn't believe it when I said I didn't have any. He recommended that I watch some pornography, and I thought that to be a fairly odd recommendation to give.
In my experience with a healthcare provider, just recently, about the last, say, 2-3 weeks, I disclosed to a healthcare worker that I was intersex, and their facial expression sort of dropped. And I'm not quite sure whether it was because they were surprised or if they actually knew what intersex was. Also, I've had a bit of an issue with my GP explaining my sexuality, as I think he's more ignorant and just chooses not to acknowledge there's other genders other than male and female. I don't really go and see him unless I'm dying or I have to, so that's pretty much it.
My experiences with healthcare providers have been a bit mixed. A lot of assumptions, a lot of misunderstandings, and I don't feel safe. I don't feel safe to be myself. I feel like I'm required to give an answer. I feel like I'm required to be female. The spikes on my back go up a little bit, and I get quite conscious of where I am, and that I'm not generally in a space that has an understanding of being gender fluid, being queer, of being non-binary. Yeah, it doesn't inspire me to go back that often, so lucky I'm healthy.
So I've had some pretty bad experiences with healthcare providers as both a queer woman and a trans woman. In fact, I can probably count on one hand the good experiences I've had. Most common experience is generally what we call trans broken arm syndrome, where you go into hospital, you go see a doctor or whatever for broken arm, and it becomes all about your hormones, your trans status, things that are utterly unrelated to the issue at hand. And that's frustrating, as I'm sure you can imagine.
There's this one medical centre that I go to, and every time I go I try a different GP because none of them have kind of made me feel comfortable. When I got my new Medicare card, when I had my name changed, I went up there and I was like, this isn't my name anymore, can you update my details? And I sat down and waited in line for a doctor. And when the staff called me up again, they said my dead name, they said my old name. You don't want to get up when someone says a name that doesn't look like it should belong to you. And it was really awkward, so it just felt like I was in a zoo and these people had never seen a trans person before, so it was quite uncomfortable.
10, 12 years ago, I started kind of presenting with abnormal pap smears. When we were in the waiting room waiting to meet with the professor to get the results, my mother made a comment about, using sex toys was probably the reason why I was, having these abnormalities, which was completely absurd and totally heterosexist and homophobic. Anyway, and I thought...
So some of those experiences include being misgendered, being told to remove binders when they were not imminently affecting my health, being asked to elaborate on my gender identity or hormone treatments that are not relevant to the illness that I was querying. For example, being on both estrogen and testosterone and having a hysterectomy.
So when I came to Australia and I accessed health services, I never felt that there was any form of discrimination until I had discussions with people outside of the clinic. I presented with an STI, and the doctor asked me how I identify my sexual orientation. Before that, he sort of assumed that I was straight. So I told him that I had sex with men, and I could see his body language had completely changed.
I went along to an appointment, and the nurse that I encountered there, not only was she rude, I mean, it could have put my own health at risk. She looked me up and down in an obvious way that made me feel uncomfortable and asked me if I was a woman or a tranny. Well, I mean, hello, I'm here because I have breasts. Wouldn't matter what I was, I'm here with breasts. And I have to say, even though I perceive myself as a strong person, I felt so uncomfortable I nearly left.
I was the lead in a musical, and it was a very high stress environment. I was starting to get sores on my body. My doctor, which was our family doctor at the time, questioned me about my sexual history and then come to the immediate conclusion that because I was getting sores on my body, I was HIV positive and that I had contracted AIDS. And so this was an assumption that our family doctor had made, that he disclosed the diagnosis over the phone when my father was on the other end of the phone without any confidentiality. The assumption between being gay and AIDS, especially using a term like AIDS, in I guess it would have been around 2001, 2002, to be totally discriminatory.
There was one time I have a spinal injury. So I was laying inside the bed with the curtain over the top because I had a severe headache, and I could hear the nurse and the doctor talking behind the curtain saying that, they're really confused about their gender, so they don't know what they are, so we just need to do a medical exam to figure out what they are, and that petrified me. I thought I was going to be assaulted, so I ran.
My experiences with the healthcare providers have been mostly positive in my history. When my partner and I decided we wanted to try for a baby, my GP found us a fertility specialist who she knew had done work with LGBTIQ people in the past, and our whole experiences with that process has been fantastic and very positive and non-discriminatory.
I have great times accessing healthcare services, from it being at ACON, where I've gone to A-Test and had my sexual health checkups recently. That was just a great time, good laugh, good yarn with the mob there. Or every time I go into the local Redfern AMS, which is always a good time. I see Mob, I see cousins, Marnie works behind the counter, it's always a good time.
I've had fantastic experiences with healthcare providers. There's never been any problem. Any doctor I've seen, any nurse, they've really embraced that I'm deaf, actually, and some of them have wanted to have a little bit of a joke with me, a little bit of a tease with me. Oh, here's a troublemaker, he's deaf, he's up to no good. So we always have a little bit of a laugh. I feel quite a strong bond with my experiences within the medical and healthcare community. My access to PrEP, for example, has been really easy. Has been very clear communication. I've known exactly what's been involved. The doctors and the nurses have all been on the same page as me.
Lately I've been seeing some nurses they have down at ACON, which I feel a bit more freely and open to talk about particular issues that I may need to discuss other than a common cold or flu.
But I have always made sure that I told doctors and anyone else, look, I'm a gay man, and if you're unhappy with that, you're the wrong sort of person to be treating with me, and I'd like you to find someone who can cope with a gay man. Next question, please.
There's a lot of GPs out there that they really don't know much about the type of sex people are having, especially within the LGBTIQ plus community. For example, just thinking a urine test and a throat swab was enough, when obviously, if I'm having sex with men, I'm having anal sex, so, just not asking if I needed an anal swab, for example.
So it would be really great. One of the things I'd really love to see is if, when I actually went into the doctor, there was a welcome here sticker that I could, I would know that there's at least some level of understanding there.
Really, they should just listen. Listen to what you have to say. Leave any prejudices at home. Act professionally. Don't ask questions that don't need to be asked unless it's absolutely necessary for the treatment that you're providing.
In terms of healthcare, the best practice for inclusivity is non-judgment.